Hi, my name is John Consalvi and I'm the CEO of LinguaHealth and Grupo Lingua. I'm here today talking to Elizabeth Steffen about her experience working in hospitals. Elizabeth, thanks for coming.
Hi, John. Thank you.
Today we're going to talk a little bit about parents in hospitals. They come into a hospital, they need services, their child possibly had a traumatic brain injury or some other type of issue that requires the services of a speech-language pathologist in a hospital. How can these parents navigate the system? How can they successfully interact with the speech pathologist and the teams of people that are working with them?
Mm-hmm. Well, it really does depend on what level of care the patient or the child is in. If they're in acute care, it's making sure that you're vocal with your nurse or your physician if you're noticing changes in voice, changes in behavior, changes in swallowing, and a couple of other areas. If you're noticing those things, make sure you voice those concerns to your primary care provider. And then from there, once you have a speech therapy consult, let's say in acute care, the speech pathologist will come in and do an overall diagnostic and then make some recommendations. And the best thing that the parent can do is just to ask as many questions. Any question that you have that comes up, make sure you're vocal. Mm-hmm. Okay? And a lot of times when you're in that setting, there's just so many different professionals and so many things going on, it's easy to step back and just be afraid to ask questions. And I see that so often. And just to make sure you're vocal about concerns. And the speech pathologist will be able to make those recommendations and provide you with recommendations of the next care or service line of what the patient or the family can do. And then if it were outpatient, making sure that from acute care or acute inpatient that you have an order, you have a script from your medical care provider, and that you are aware of insurance coverage. And asking your speech pathologist, with my insurance coverage, how much is covered, because a lot of times that can impact service too. So the best recommendation I have is to ask questions to providers.
The other side of that is the clinician, the speech-language pathologist. From your experience, what would you say to newly minted speech-language pathology graduate students to help them become better clinicians in hospital setting? What do they need to do to be a better listener, a better communicator?
It's just to make sure that you have a great CFY supervisor coming out of graduation, that they're comfortable, and to know the new trends in healthcare. So asking specifically when it comes to ICD-9, ICD-10 coding, when it comes to different insurance companies, does the evaluation need to be faxed or submitted to the doctor prior to initiation of treatment? It's just to make sure that you're very careful, and if you have any questions at all or you're not certain about what to document or how to proceed on the coding and billing end of things, to make sure that you ask someone or that you contact ASHA with any questions that you have. Because it does change a lot, and it can get pretty tricky.
Now, I know you have a master's degree in business administration with a healthcare focus. Why did you decide to do that?
I feel that it's giving me a more rounded version of what we do. Speech pathologists are needing to become more entrepreneurs. They're needing to know the coding. They're know insurance, know billing, and know exactly from evaluation to treatment to discharge, exactly what they're doing. And I think getting that MBA focus is allowing me to see the marketing aspect, the finance aspect, the accounting aspect of everything that we do, and seeing everything with a rehab focus on a grander scale.
Well, speech-language pathology has evolved in the hospitals. It's come a long way. It's getting more complex. There are a lot of other issues at play. What do you see on the horizon?
I see the profession not as isolated. I think when we first came in, we were looking at just swallowing. Swallowologists was the initial perception. And now we're moving into more cognition, speech, especially after brain injury and stroke. I think it's definitely moving to be more multi-disciplinary, that we need to have that perspective. We're not the only care providers on the team. There's the occupational therapist, the physical therapist, and how can we best coordinate our care services to best provide treatment to our patients. And I really just see us having a greater awareness of the patient as a whole and the system as a whole. So what I've really tried to do in my experience is not just start in the NICU and stay in the NICU. I've tried to do the NICU all the way through to outpatient rehab so I can see that full continuum of services. So just opening up our eyes and knowing that we are not the isolated profession, that there are so many different care providers on the team that we can use as resources too for our patients.
Very good. So we don't need superstars, we need team players.
Team players is the key. Yep.
Well, thank you very much, Elizabeth. It's been a pleasure.
Great. Thank you.